The winter flu season is approaching, and President Trump battles a positive COVID diagnosis. Dr. Malathi Srinivasan of Stanford Healthcare has your Medical Monday report only on CBSN Bay Area.
Everyone in the health community hopes that the president of the first family recovers seamlessly and easily from this terrible virus. The majority of people who get infected do well, but the people who are getting ill are getting very seriously ill. The president is in a very high risk category. Not only is he 74, and we know that the risk starts to go up over 75 for death, but he also is overweight. And that in itself is an independent risk factor for having severe complications. I think our hopes are this, is that first he recovers well, and second, that all Americans are going to be able to get the same standard of care that I hope the president is enjoying. We've seen tremendous health inequity in the country in terms of access to care and in terms of availability of medications and availability of resources. So I think we're all hoping that this personal experience of illness and with hopefully a rapid recovery will lead to an increased focus on the health inequities that we're all trying to fix. The other thing I think this points out is that the virus really is agnostic when it comes to who it infects. All you have to do is be near someone who's infected, not socially distance, not wear a mask, and not follow the hand hygiene processes. And repeated testing is only helpful if it's paired with action. So I know that the president and his close confidants have been getting, I think, the Abbott test every day, but certainly that's not enough when it comes to not taking the next necessary set of preventive measures to be able to both ensure that you're not close to people who may not know that they're ill, and then also that once someone is ill, to be able to do the appropriate contact tracing to see who people have been exposed to and who else they might have infected. Distributing 150 million COVID rapid tests throughout the country is an absolutely wonderful thing, but it doesn't begin to address the magnitude of the need that we have in America. Let's just take an example. Right now, there's about 50 million children who have gone back to school. So if we just tested each of those kids, even once a day for the next couple days, all of those tests would be gone in 3 days. So right now, we're only testing about 850,000 people per day, which is not nearly enough. And as the pandemic is spreading and as more people are getting infected, we need much more. So this is a very good start. The other problem is this. The Abbott test that is being used for the rapid antigen test, which is based on a nasal swab, not a deep nasal swab, but a more shallow nasal swab, has only been tested in people who already have COVID symptoms. And absolutely no one knows how it performs in people who have no symptoms. So Abbott says that in people who have symptoms within about 7 days, they have a 97% sensitivity rate, although I think most people are finding a lower sensitivity rate. But in people who are asymptomatic, it's thought to be somewhere in the 70 or 80%. So we're going to be missing a lot of people, and it's not an accurate test. So we're also going to be having lots of false positives and lots of false negatives. This kind of testing is meant for daily repeated sampling. It's not meant for a one-of. So I think it's going to give a lot of people false reassurance, one way or the other. This pandemic has been a national and an international tragedy. It's unthinkable now, but if we had said back in January to everybody, if you could just quarantine for 1 month, every single person in the world, wherever you are, we would have ended this pandemic and we would all be back to business as normal. At that time, something that extreme seemed extraordinary and undoable. And now we're facing the consequences of us not understanding or responding to the way viruses spread. There's nothing surprising about what's happened. We know that this virus is highly infectious, the SARS-CoV-2, and we know it spreads person to person. We know it spreads through aerosols. We know it spreads through contact, and the scientific misinformation that's being distributed about the fact that none of these things are true is part of the reason the pandemic is spreading. People are getting mixed messages. Our national agencies are going back and forth about what their recommendations are. And rather than being more conservative and saying, we don't know, let's not do stuff until we find out, they're saying, do stuff, and then if we find out, we'll have you change your behavior. All of that stuff contributes to disease spread. So, misinformation at the, misinformation, whether it's deliberate or not deliberate, has considerably handicapped our ability to effectively respond from a public health perspective. I think that's the first thing. I think the second thing is people have a hard time changing their behaviors, and until they see evidence of something bad happening, it's very hard for them to say, let me upend my entire life just based on a theoretical risk of something that's going to happen in the future that could be negative. So until people, I think, started seeing the terrible number of people who are getting sick in New York and hospitals being overwhelmed, I think that was, for Americans at least, sort of our wake-up moment. And that wake-up moment didn't last very long. So right now, people are socially being a lot more lax than they were before. And although what we know about the virus has evolved, the behaviors that we need to correct that and to be able to slow down the spread have not been widely implemented because people are becoming fatigued of being quarantined. Stanford study was the largest study that had examined how many Americans have actually had COVID. And they'd studied about almost 30,000 Americans who were on dialysis in almost all states, in 46 states, and had found that about 10% of them, a little bit less than 10%, had had COVID. But here's the thing, not only was it only 10% overall, but less than 10% of those people probably knew that they had COVID. So the number of people who have it, who are undiagnosed, is probably in the millions. And we already have about 200,000 people who have died in this pandemic already just 9 months in. And so we just don't know what the next 9 months or the next 10 months is going to hold. So I think that this is important news for all of us to remember, especially because we're also seeing very widespread variation depending on what state we're in and whether or not we're an underserved minority, for instance, or people who have had essential work who've been unable to shelter. Herd immunity is a time when enough people have had an illness that the likelihood of spreading it from person to person is very low. And what this tells us is that we are nowhere near herd immunity, and we've already had 200,000 Americans die. And the reason this is important is because to get to herd immunity, natural herd immunity, means that we typically, for most things, we think about having between 70 to 90% of a population already exposed to and survived and immune to a disorder. And in this case, that would mean hundreds of thousands of more people dying if we just wait for herd immunity to occur. And we're seeing amazing variation by state. So for instance, in California, remember these are numbers from July, not from October where we are now. In July, only about 4% of Californians had tested positive for COVID-19, but in New York, it was up to 30%. So we're seeing variation based on city, based on geography, based on ethnicity, with people who are African American or Hispanic hitting almost 20% of people who of patients with COVID exposure in the past, whereas in the non-Hispanic white population, it's less than 5%. And so these numbers really point out that people who are African American and Hispanic often are living in areas with multi-generational families and in slightly more crowded conditions, and they have work that is essential to the United States in that they're going out and working almost every day. So I think that this points out the fact that we need to do a much better job of trying to reduce the spread of this virus through social distancing and not laxing our standards. I think it can be really quite devastating. So pool testing was developed to conserve reagents so that we could test more people cost effectively. And also because we have limited reagent supply is to spread it out so that more people could get tested. It works really well when the prevalence of the infection in the community is low, like less than 4 or 5%, because then the likelihood that if you have a group of people who are low risk, when you pool all of their blood together, that they're going to be negative is very high. So you end up saving reagent, testing more people, and then if someone turns out positive, then you go test the 4 or 5 people who are in that pool. So in college campuses where people are not sheltering well, where they are starting to congregate more, we know that many schools that were opening are now shutting down again because people weren't doing a very good job of social distancing and they were going to parties, which, you know, they knew they shouldn't be doing it, but they did it anyway. And so I think that it has a potential to help, but not as the infection rate starts going up. So while there's very little in the community, that's a great thing to do. In college campuses where infections spread like wildfire, maybe not so much. What's happening in Florida, I think, is a major untested social experiment. And anytime we're experimenting with children, we have to be very careful. And whether people think about it in that way or not, that's what it is. So the problem is the Florida data is based on the kids who are getting sick and presenting as sick, whereas we know the majority of people who get it, especially kids, are asymptomatic. And not only are they asymptomatic, but they're asymptomatically spreading. So here's the rub. There's two things. The first is that kids don't live in a bubble, and they're living with their families, they're living in communities, and when they get sick, they're going to spread the infection to other people who are more vulnerable. And we know the children who are already who are immunocompromised or who have higher risk factors for getting sick are getting sick. And we've had over 50 deaths of children in the US from this pandemic. And I think as the schools reopen, we're not quite sure what's going to happen. We're hoping that number doesn't increase. So the other thing that to really point out from Florida is that the rates aren't dropping as much as expected. So you know, if people were doing great social distancing, the rate of people getting sick would be going down. And so it is going down a little bit. But if you look at schools, the rates of symptomatic children in school districts that have opened recently, like less than 2 weeks versus more than 4 weeks ago, the rate of drop is much lower in the schools that have opened before, telling us that kids are spreading this. And they're not spreading it maybe and getting as symptomatic as people who are in college, who are really not socially distancing, or in high schools. But certainly the elementary school children are still at risk and they're still going to spread it to other people. So I think that the procedures that people have in place, everyone is doing the best they can. And there are groups of children who definitely need to be back in school, people who have food insecurity, who are having trouble coping with being at home and have mental health or behavioral health issues that indicate that they need to be in more congregated settings, or children who are having trouble focusing because you know, it's hard to stare at a screen all day when you're used to interacting and being out and about. So there's very legitimate reasons why people want their children to go back to school and why school districts want children to come back, especially for the developmental and the socialization reasons that are so important for early milestone for children. But I think the bigger issue right now is this pandemic. Hopefully, if we get widespread vaccine by next year, by next summer or by next fall, hopefully we will have bent the curve significantly by then. And one has to sort of weigh the short-term effects of having children out of school with the long-term effects of having them in school and potentially having them expose themselves and other people to a significant infection. It looks like a lot of the Florida schools are doing a great job with everything that they can do. But winter is coming and people are going to be indoors more. And that's also going to change the dynamic of what happens both as influenza and COVID begin to both bubble up. I think that everyone's in a very tough situation, and in California, we're in a doubly tough situation because not only are we asking people to not be inside and then go outside, but we also have the fires, which are forcing us to stay inside because the air quality is so bad. And although typically California doesn't have the kind of harsh winters with snow, with the fires, we certainly can't go outside even in fall. It's been very challenging. So I think that the standard things that people talk about in terms of always wearing a mask, that's the number one thing we need to do on top of washing our hands. That the next set of things have to do with the amount of distance we need between people. The 6 foot rule that the CDC had offered early on is probably not enough, and certainly not enough when people are exercising or when they're sweating or when they're doing things where they may be projecting. So I think that universal masking, universal distancing, better air filtration systems, looking at the flow and ergonomics of the school in terms of how their ventilatory system is doing, how their filtration systems are doing, and paying attention to the dynamics within children's groups, because children have a very hard time, especially younger children, following these kind of rules. They're naturally affectionate and they run around and they bump into each other. So, how do you tell a 4-year-old or 5-year-old who might be going to school, you have to sit in this seat for 8 hours and really not move too much, or you can move but only within a pod. So there's the pod system might work, but only if every single member of that pod and every single person's family within that pod works, and follows all of the social distancing rules that we hope they do. But again, these are often impractical, and it just takes one person to break that pod or to not respect those boundaries, and then everybody else within that group is at risk.